I liken it to an IUD. So an IUD reliably prevents pregnancy, but it's only placed inside women who are in a monogamous relationship because, yes, it prevents pregnancy, but similarly, it doesn't prevent any STDs. So maybe there's a happy medium here where the PrEP pill is maybe given to men in an established monogamous relationship so that outside of predictable sexual behavior, there is less of a risk for this.
We can't govern how people are having sex.
Nor can you with an IUD placement.
Right.
So it's just you know,
I think
I
think the biggest thing in life when it comes to your health is truly putting the big picture together. And the reality is there's so much confusion out there. We just had that conversation. And again, I applaud your desire to spread the entire message. I want to ask you, and this is, I'm just curious, you're a nonprofit, but does your organization receive funding from any pharmaceutical companies?
No.
Okay, so this is, and the reason I ask that is because this is a heck of a good advertisement. For
the drug.
Yeah, I mean, that's,
You're not making money selling this drug.
No, we're not making money selling this drug. And I think the other thing to say is that this is a medication that, taken daily, is safe and effective in preventing HIV.
What's shocking about this is the without fear part. That's my issue. You're a doctor.
You're a little cavalier and reckless.
Well, it's also, as a mother of 3 7-year-old boys, the F word just came up in the house last week and we had to address it. So now I have to worry about it being introduced just in the car driving down the street. It's a little unfair to parents of young kids.
It's bold. It's intended to be bold. So there are 3 populations that are disproportionately impacted by HIV right now. There are Black, gay and bisexual men, Latino gay and bisexual men, and transgender women. So if we don't change our approach to education, and
couldn't agree more, and that's why we've covered this topic on our show many times.
1 in 2 Black, young, gay, and bisexual men will be infected with HIV in their lifetime.
And you know what?
1 in 4 Latino, gay, and bisexual men will be infected with HIV.
And that's why we've discussed this
40%,
many times on the show before.
Of transgender women.
But to put a billboard out that says blank without fear.
If you want to be outraged about something, be outraged about what I just said.
Everyone's going to see that. So I understand your campaign, and I'm actually all for your organization raising awareness. And Adam, since you haven't had the opportunity to talk, I want you to address this before we go, is that 1 in 8 people with HIV don't know they have it. Too often in relationships, one partner in all relationships will say, I'm good, I'm fine. And then the other partner will take them at their word. And that's where, if everyone sort of has this fearless mentality, and Adam, before we go, just because I haven't given you too many opportunities to talk, what's your biggest message when it comes to educating people?
First of all, get tested. That is the most important aspect when it comes to HIV knowledge. And also wear a condom, which is 99% effective against HIV and other STDs. What I think is the most important takeaway when it comes to PrEP is the fact that PrEP is a tool, part of a toolbox that includes condoms, testing, and other preventative measures in order to protect yourself during sexual activity.
And although we may all disagree at times on messaging, I actually appreciate both of you raising awareness. A really important topic. Thank you all so much.